Given the dangers posed by COVID-19, leaving our homes to seek first-level medical advice represents an increased medical risk, especially when hospitals and healthcare centers are operating at full capacity and can potentially expose visitors to an increased risk of infection. This diminished ability to get timely medical advice is leaving many patients unsure of when their condition is urgent enough to require a visit to the hospital or whether they should stay at home a bit longer to see how their symptoms evolve. At the same time, many doctors and healthcare providers who want to help are risking their own health unnecessarily by treating a multitude of patients who have potentially only mild or unrelated symptoms and are clogging hospitals, putting themselves and the healthcare providers at increased risk and taking their valuable time and attention away from more critically ill patients. We at Factored believe that leveraging technology in the service of our community represents our duty in these difficult times. This is why we've created a COVID-19 screening application that analyzes symptoms, helps flag critical cases, and connects patients with doctors remotely, allowing patients to get initial care from the safety of their own home and freeing up critical medical capacity for those who need it most. Our app enables users to register medical history and symptoms in an easy-to-use form, and also analyzes video and sound recordings taken with their mobile phone to measure oxygen saturation, heart rate, and respiratory frequency. The video of their fingertip against the lens of the camera uses computer vision to analyze changes in red and infrared light refraction caused by the blood flow on their fingertip. The audio measures the frequency of their breaths using signal processing algorithms that segment, filter, and determine a normal breathing threshold. After analyzing these symptoms, the application uses a scoring system that we co-created with doctors to provide an initial risk assessment and also provides basic recommendations. All patient reports are safely stored so doctors, once registered on the platform, can review patient cases ordered by level of risk. Doctors can view information about symptoms and pre-existing conditions, and if they determine that a patient requires more attention, they can contact the patient via a mobile video call on the platform. And of course, doctors can also make notes on the portal about their assessment, diagnosis, and recommendations. They can change the status for each patient based on this assessment. The privacy of both patients and doctors is paramount. This is why there is no personally identifiable information that is shared on either end, and why patient phone numbers are hashed and encrypted. At no point do patients or doctors have access to each other's contact information. We've created an application that we hope will help both patients and doctors avoid unnecessary risks. We are AI experts and software developers who voluntarily created an app to help. And although we've worked with volunteer doctors to develop the solution, we are by no means official participants in public or private healthcare. As such, we really need support to help patients. We're looking for partners in relevant public or private healthcare organizations to help consolidate adoption and proper use of this solution. That way we can focus on technology, which is what we know how to do, and let experts distribute the app and properly coordinate patient care and medical requirements.